Well, what are the radiation risks? We look up here and we see this term microsieverts. We won't go into that because when people ask how much radiation is this, does anybody get that question from your patients? Everybody in this room has had that. You don't say, well, it gets 71 microsieverts. What do they want to know? Number one, am I going to get cancer and die? Number two, if I'm pregnant, trying to get pregnant, am I going to have a birth defect happen? Those are the two main questions. Well, the Galileo's in the default exposure, 71 microsieverts. In the maximum exposure, 130, which you might want to use for adults. Compared to medical CT, 887. And as I said, Galileo's has the lowest in the industry. Well, what does this mean in terms of practical comparisons? Well, let's look at some standard comparisons. A Galileo scan is equal to 2 to 4 panoramic radiographs, depending film or digital, or 1/6 of a film-based full mouth series. So, for instance, if you're taking full mouth series, and if perhaps you're using film, you can do a Galileo scan, have some regular bite wings, have a lot less dose, and a lot more information. It's slightly less even than a full mouth series of digital images. Now, I realize not everyone takes a full mouth series these days, but you can with a Galileo's take a scan. We still recommend some intraoral imaging, like bite wings, and then you have less dose and more information. So that's a good combination. What is that in terms of what the patient thinks? Well, we usually tell them background radiation. Every time you live a day in the US, you get a certain amount of radiation. So we just refer to this as background radiation. It's not a day in the sun. It's cosmic rays. It's the building. And believe it or not, every one of us are irradiating everybody else. We've all got radiation coming out of us. I'll give you a little time to shift your seats around, get a little bit further apart. But it's true. We just recently found out that a Galileo scan is equal to eating 700 bananas. I don't recommend that either. And in fact, now people are quoting a banana equivalent dose. But what it's showing is these are very low doses. For a default Galileo scan, 8 days of background radiation. It's not very much. Or 8/10 of a chest film. Some people like to compare it to chest film. It's 8/10 of a chest film. All right, that second question. What about birth defects? Well, 0. Let me explain. I'm going to have to go professor here just a little bit, so bear with me. We have two kinds of effects from radiation. Stochastic, based on risk, like rolling dice. The more times you roll the dice, the more times you're going to get 6s or whatever you'd like. And deterministic. Let me explain. Stochastic effects are where the risks are proportional to the dose. A little bit of risk, or a little bit of dose, a little bit of risk. That implies no threshold. So we use the Alera principle, try to keep the dose as low as possible. Good example of a stochastic effect is cancer. It's a very good example. That's the one most people are concerned about. Mutations, well, mutations in the cells of the body can lead to cancer, so that's another type of stochastic effects. The severity of the effect is independent of the dose. Doesn't matter if you got a little bit of radiation or a lot. If you get the cancer, it could be severe or not severe. It doesn't have anything to do with dose. Now, deterministic effects, effects where severity is proportional to dose and there is a threshold. You have to have a certain amount in order to get the effect, like sunburn, like in utero, that means exposure to the fetus developing in utero birth defects. Now, as it turns out, if you will go to a document in the American Dental Association produced by the Food and Drug Administration and a panel of experts in all the specialties of dentistry, they put out a document called Selection Criteria for Radiographs, like what radiographs should you order for which patients? And in that document, it addresses the issue of pregnancy and radiation therapy. And in pregnancy, because it is a deterministic effect and the amount of radiation needed to cause a birth defect is way above what you get with any dental procedures, it'll say that pregnancy is not a consideration. Neither is radiation therapy. I mean, that's like taking water to the ocean, a bucket of water to the ocean. Okay. But as I tell my students, we treat people, not just teeth. So people have hopes, fears, and you want to be sensitive to that. In fact, you will read that over the 9-month gestational period, the fetus, in terms of background radiation, receives the equivalent of 75 times a full mouth series with film. We're talking about orders of magnitude above what can be caused by dental radiation. So I tell you this not just for cone beam CT, but for any imaging. You cannot cause a birth defect with dental radiation. You might be thinking, oh, why isn't this popular information? I don't know. It's been around about 40 years. I wish Dr. Oz would talk about that as well. In fact, if I were Dr. Oz, I would talk about a few other things which I'm going to bring up in just a minute. Okay, radiation burns. So you don't get a sunburn walking out to the parking lot. A little bit of sun, a little bit of risk for sunburn. No, you got to be out there for a while. That's deterministic. Same thing with birth defects. Well, even with the Galileos, you can still reduce exposure. If you've got children that you need to expose for some reason or another, well, you can cut it down to these doses, 14 instead of 71. You have the ability to do just the maxilla, just the mandible. So within the Galileo system, you can reduce the dose further if that's going to be very important. So we have these tables available as well. All right, here's how we compare it to the others. I'll give you just a minute or two to write all this down. Just kidding. But I do want to highlight a couple things. Number one, this is full mouth series with D-speed film, 47 days of background radiation. A Galileo's cone beam scan at the default exposure, 8. So you're a lot less. Okay, now if you compare it to panoramic, again, it depends on if it's film or digital, we can go 2 to 4, because panoramic machines vary as well. All right, so that kind of gives you an idea of the doses. They're quite low. And here's what I would ask for Dr. Oz. If we're concerned about exposure to the thyroid, and we don't recommend thyroid shielding for the Galileos, the dose is so low. But if we're really concerned, Dr. Oz and even the ADA should be saying, get rid of film. You're going to reduce thyroid exposure much more by going to digital imaging than by any thyroid shield.